Is a frequent urge to urinate with little output a sign of urethra problems? Imagine feeling like you need to go to the bathroom all the time, but when you do, only a small amount of urine comes out. That can be confusing and frustrating. This symptom can sometimes point to issues with the urethra, but it's important to understand what's really happening in your urinary system. The urethra is the tube that carries urine from your bladder to the outside of your body. If there is a problem with this tube, it can cause symptoms like frequent urges to urinate with little urine passing. One common issue is a urethral stricture, which is a narrowing or blockage of the urethra. This can happen because of infections, injury, inflammation, or scarring. When the urethra is narrowed, your bladder tries to empty, but the flow is restricted. This leads to feeling like you need to go often, but only small amounts of urine are expelled each time. Urinary tract infections are another common cause. When bacteria infect the urethra or bladder, they cause irritation and inflammation. This can make you feel like you need to urinate frequently, sometimes with little urine because the infection causes swelling and irritation. You might also experience burning or pain during urination. These infections are quite common and need medical treatment to clear up. In men, an enlarged prostate can press against the urethra, causing a similar problem called bladder outlet obstruction. This makes it hard for urine to flow freely, so you feel the urge to go often but only pass small amounts. It's important to note that this involves the prostate but directly affects the urethra's ability to carry urine out. Sometimes, the problem isn't structural but functional. Overactive bladder is a condition where the bladder muscle contracts involuntarily. This causes sudden and frequent urges to urinate, even if the bladder isn't full. In these cases, the urethra itself may be normal, but the coordination between the bladder and urethra is disrupted. Other causes include nerve issues that affect how signals are sent to the bladder and urethra, inflammation, or even tumors. All of these can lead to similar symptoms. Because many conditions can cause a frequent urge with little output, it's essential to see a healthcare professional. They can perform tests to determine if there's a blockage, infection, or other problem. From a bladder health perspective, persistent symptoms should always be evaluated promptly. Conditions like infections or obstructions need treatment to prevent complications. While urethral problems are one possibility, it's also important to consider other issues affecting the bladder and urinary tract. If you experience these symptoms regularly, consult your doctor for a thorough assessment. Remember, early diagnosis and proper management are key to maintaining healthy bladder function and ruling out more serious issues like bladder cancer.